Good to be back with you. So welcome back to the channel. One of the things that we wanted to try to do this year that's new is to get videos from you with questions about hair loss, about hair transplants, so we can actually answer them here in the channel. So we have one here from one of our patients, and we're going to show you how we want to do these things. We're going to also put our email contact here so that if you have questions, you can record a simple video at home and then submit it to us, and then we will take them and we'll make a video response and then publish here in the channel. Of course, if you don't want to appear on the camera, that's fine too. Just send your question to me and I'll record a video responding it to you. Okay, so hopefully you enjoyed this. It's kind of a more laid back way of us talking about hair. I get questions all the time, and these are going to be the most common ones. But again, submit your questions to us so we can do the answers for you. Okay, in video will be better, so we can do it like this. But even if you don't want to record yourself, then we can do it some other way. All right, so let's go ahead and get started with the first one. Her name is Stella. She just sent us a video during Christmas time, so it took us a little while to get around to doing it, but you see the response here. Okay, hope you enjoy it. If you like the channel, click the subscribe button, click the like button on this video so we can get it to more people. And let's go ahead and talk to Stella.
Hi, Dr. Barusco. I have a question about losing hair postpartum. After I had my son, about 3 months later, I lost a lot of hair, and right now I'm pregnant with twins, and I'm hoping there's something I can do to prevent the hair loss. Do you have any advice?
Hi, Stella. Thanks for your question. We appreciate you sending it over to us. That's actually a very interesting question. It opens up a huge dialogue here, so I could be talking to you about this for hours and hours, but try to keep this nice and simple, okay? Pregnancy and hair loss, very common topic that we get. So again, congratulations, first of all, on your pregnancy, on the twins. I'm sure you're very excited, your husband as well, and the little one will get a couple of little sisters or little brothers or one of each, I don't know. But anyway, very exciting time for you. So what I can tell you is, don't worry, but you're doing the right thing about worrying right now. So again, don't worry, but it's good that you worry, because then we can prevent you or get your hair recovered quicker. Not to go too deep into the endocrinology aspect of pregnancy and hair loss, but just to be simple. When you get pregnant, because of the hormonal changes that your body will go through, your hair will actually become very lush and very full, and it's a great time for hair. A lot of times patients tell me, wow, during my pregnancy my hair was the best I've ever had. It was really full, it was really nice. So that's because the hormones, And again, I'm not going to go into too much of the details on the endocrinology, but when you deliver the baby, whether through a C-section or a normal delivery, these hormones change, right? And plus, there's some blood loss, and there's all the excitement and the trauma of the, physical trauma of the delivery itself. And that can put the hair into what we call shock loss or telogen effluvium, right? And your timeline and your first pregnancy fits perfectly, because telogen effluvium usually happens about 3 or 4 months after the injury or the onset event, right? So in your case, when you had your first child, 3 months later, you start noticing the shedding, and then I'm assuming after a while it stopped, right, like it normally does. And so that's pretty common. It's telogen effluvium. It's not a disease, but it's something that we all go through. Women in particular, when you have a baby, it's very common. When you have major surgery, a few months later you can get it. We're seeing a lot now with the pandemic, also hair loss associated with that. If you end up in the hospital for something, or you lose someone that's dear to you, or death in the family, any reason like that can cause you some physical or emotional trauma, can trigger telogen effluvium after a few months. It's usually a benign condition that's self-limited. That means it gets better even if you don't do anything. But what I notice a lot in patients is that they get so worried about the hair loss, because you can see actually a lot of hair coming out, that they get so anxious about it. That becomes a self-fulfilling prophecy, right? So they get so stressed about the hair loss that the stress causes more hair loss and so forth. So it becomes kind of a chronic telogen effluvium, which can be a little bit more challenging, okay? I have a lot of patients on chronic telogen effluvium, and every one of them I find needs a different approach, and we have to test different treatments, different medications to see what works for you and for each individual, right? One thing that we have to address is if you are breastfeeding, if you're going to breastfeed, which I recommend, by the way, I'm a very big proponent of breastfeeding. It's good for you and good for the baby, so if you can, do it. If you can't, then that's okay. But if you are breastfeeding, I can't put you on some of the medications that we normally treat hair loss with, so we'll have to wait a little bit. But I can kind of, hold your hand and counsel you through those first few months of after the babies are born, in your case, with the twins, so that you can, still breastfeed, and we can kind of hold on to the hair treatment until after you stop. If you're not breastfeeding for whatever reason, then we can start the treatment right away, right after the pregnancy, and I'll see you for a consultation. I will recommend some things for you to take that are very safe and very effective. You're not going to have to take these forever, probably, just until we recover your hair, and then we'll keep watching it. So that's how it is. I mean, it's good that you approached us now. I'm sure you have our contact information. I've seen myself on the video that you're watching there, so I know you have our contact. I can talk to you in a little bit more detail in a consultation. It's free. But yeah, don't worry. Enjoy this time of your life, the pregnancy. I hope everything goes great with your delivery, that the babies are healthy and everything. And we'll talk after. Let me know, and we can put you on the right track. All right? So thanks for sending the question. That's great. If you out there, like Stella, are wondering about other things like this, send a quick video to us, and we'll make sure that we responded to you. Okay? I'll see you next time. Take care.
Thank you so much for your answer. Merry Christmas.